Hello, hello, hello. This is Cassandra Edwards, owner of the Chosen Few Financial Empowerment and Wellness Workshops, also your host of QuickWits interviews. And today we are here with Jenny Kuhns, owner of All Is Well Massage and Skin. Hey, Jenny, what's going on, lady?
Hi, how are you?
Wonderful, wonderful. Hope you are.
I am. I'm doing real well. Thank you.
Great. I'm glad to have you here today. You are here today to tell us all about your business, All Is Well Massage and Skin, right?
Right, I am. I am super excited because I've actually opened a new, larger office. It's in the same building where I've been located for the past 3 years, but it's a bigger, cleaner space with more offices. So it's a big step up for me, but I'm ready for it.
All right, that's exciting. That's really exciting. So, I ran a massage therapy business, so I'm always excited to hear about what people are doing now because things change. Of course, obviously, if you care about people, you're going to be putting in all that good work, effort, and passion. So, tell us what inspired you to get started into massage therapy and aesthetics?
So I've always been a business owner, and when I moved to Columbia, I needed to make a business change. And I do like the medical profession as a whole, but there's not a lot that you can do medically speaking. Um, you know, uh, and also have your own business. So I grew excited about massage therapy because there were a lot of things that were going on personally in my life with friends at the time that were having problems with pain management. And there was kind of an overprescription type thing going on in those years. And, finding ways to manage pain and manage symptoms of physical problems, it's a great way to do that without the prescriptions and the expensive doctors and using insurance, especially if we don't have insurance. Massage therapy is a great option. And at the time, people were really opening up to the idea of alternative medicine, which I don't think massage therapy is alternative medicine at all. I think it's the original medicine.
Absolutely.
I've gotten away from that over the years and gotten more into, seeing practitioners that want to prescribe drugs and, that sort of thing. But when you really think about it, you see your massage therapist for an hour or 90 minutes. They're going to get to know you. They're going to get to the bottom of what you're doing or what aspect of your life is maybe causing your problems, over somebody who, sees you for 4 or 5 minutes, asks you what your symptoms are, and then prescribes something for you. So I see massage therapy as kind of both an art and a science in that, yes, you have to have medical knowledge. You have to have knowledge of the musculoskeletal system and that sort of thing. But there's also a certain degree of finesse that goes into the work. And that finesse part is probably my favorite part.
Absolutely. And it allows you to bring out some of your own personality and your own empathy and give people what they need, not necessarily what, like you said, on the prescription side of things. You don't end up with a cookie cutter solution for a very original problem with its own roots and its own issues and challenges.
Right.
So let me ask you, because I know when I ran my massage therapy business, it was very important to me to carve out my little niche within that industry. Do you have a particular specialty or a certain client that you see the most? And what's really allowed you to make this business your own?
So you are right. Massage therapy has definitely become very, very saturated, especially in my area. And so you essentially have two different types of massage therapists that work in this world. You have your Swedish spa massage therapist that you would see at, for example, a salon or spa type atmosphere. And then you have massage therapists who specialize in clinical work. And those are the types that you could see at physical therapist office or chiropractors or wellness practices and that sort of thing. So I actually run a wellness practice. And while, yes, I do have a few clients that I see now and then that do come in for Swedish, and I love them very much, My specialty is really working on clients with conditions, especially older clients. And I don't want anybody to jump off when I say older being like 45 and up, because you don't think of yourself as older when you're 45.
Well, I'm
But
41, so I'm feeling pretty old right now.
but that's kind of where I start, is kind of that, that 45-year age for the majority of my clients. And then it goes up from there. And I would say probably a full 60% of my clients are actually over 60 years old. They're at that retirement age. And I treat conditions like muscle atrophy from things like MS, stroke patients, things like that. I treat frozen shoulder, which can be complications that women find that have like fibromyalgia and things like that as well. So that's sort of where I lean. And probably the newest thing that I've been working on is something really amazing, and that's actually working on the mental health side. So I've been treating anxiety, depression, bipolar with massage therapy and seeing positive results. But the newest thing is actually treating soldiers with PTSD using those same techniques that we've been taught to treat anxiety and depression with. And there was a case study done in Sumter, not that far from here, on the Air Force Base, where soldiers were treated for their PTSD with massage therapy. And my hope is that we can take that study and we can make it into something that TRICARE would actually pay for as a treatment. Because when you have physical injuries out on the battlefield as a soldier, they treat that. You have leg problems, you have foot problems, you have back problems, whatever. They're going to treat that with a doctor's visit. If you have psychological problems, you only see a psychiatrist, and you're kind of lucky if you see a psychiatrist.
Right.
And so hopefully moving into that massage therapy, it's something that TRICARE will find beneficial and will be willing to pay for. And so I've really enjoyed working with a couple of clients here on Fort Jackson that I've been able to help with some of those issues that they've come back from overseas with.
Absolutely. And I mean, that's so needed and so necessary, because even when you think about some of the physical pain and the issues that you can have from an injury, even if it's not related to the military, and I'm a third generation veteran myself. So just some of the repetitive stress injuries that I've picked up over the years, you can find yourself depressed behind that, just realizing, my body won't do what it used to do before. I've got these issues. And of course, if you're able to get some relief and get that mobility and range of motion back, then that in itself can bring about some relief for as far as anxiety and depression as well.
Right.
So let me ask you this. I know on the backside of COVID and, the shutdown and just being restricted from operating, legally in such a high contact industry, what changes are you guys making right now? I know a lot of people would love to hear about, any steps that you're taking to ensure their safety.
So as you know, salons, spas, and anybody who worked under a license in South Carolina in what was considered a close personal contact occupation, which also included massage therapy and aesthetics, we were shut down for 10 weeks. We were unable to work legally under our licenses. And so it really, it was terrible. It was horrible. Economically, it was bad for me. But I can say that what it did is it offered the state the opportunity to look at what other states are doing and, implement some changes and stuff like that. So some new stuff that's actually going on with me is this new office. I've actually had new floors put in. There's a possibility that labor licensing and regulation will not allow offices to have carpeting anymore.
Wow.
So you can disinfect the floors with like a little Swiffer or something like that in between each client. And of course, there have always been regulations as far as disinfecting all the surfaces in between each client, never using hot stones or any type of instruments or implements without disinfecting between clients. You always have to wash your hands between each client. You always have to, if you touch an object in the room where you pulled away from your client for a moment, you have to sanitize your hands before going back to that client. All those have taken place. There's some other changes. For example, air vents in air conditioners are now to be changed every week versus every couple of weeks or every month or whenever you do it. There's 3-month long 90-day ones aren't to be used anymore, which I think is good as far as keeping that fresh air moving and stuff like that. So there are a lot of changes that have taken place. And I feel like, I really do feel like that if you have always trusted your salon or your massage therapy office to keep you safe because you believe that they do the disinfection practices that they were taught in school and that the state has told them that they have to implement in order to have a business, then you should feel safe as well, because anybody who has no intelligence about them whatsoever is always going to put their clients first, always going to put safety first, and not going to make any shortcuts as far as not cleaning surfaces, not cleaning areas, not masking up like they're supposed to, and things like that. So, definitely be afraid. Don't be afraid. If you need the work done, whether it's for depression or MS or anything that you're suffering, it's better to go in to a place of trust and get that work done versus suffer at home and not get the help you need because you think that they're not safely practicing what they're supposed to be practicing.
Right. Absolutely. I'm glad you touched on that. That's so important because especially, when you're working with an older population, and when I say older, I mean 40 and up, because when you get around 40, life gets real, and you're like, okay, it's not all about what feels good and what just, what occurs to you, but you actually, you got other people you're responsible for. You kind of in that sandwich generation where you got your kids under you and your parents over you. So you do want to make sure you're being precautious. So, I definitely do appreciate all those extra steps that you're taking. So I just want to thank you again for being on today. Is there anything extra that you want to add before we wrap up today?
No, I just wanted to thank you so much for having me on and asking me great questions. And you're a great interviewer. And, I hope everybody that watches it really enjoys it. And, give me a call and let me see if there's anything I can do to help you with whatever you have going on.
Absolutely. I'm looking forward to doing that. So if you're watching, again, this is Miss Jenny Kuhns, the owner of All Is Well Massage and Skin. She's at 9367 Two Notch Road here in Columbia, South Carolina, in the Spring Valley area, not too far from Sand Hill. So if you know where that is, not too far from there, not in Sand Hill, so traffic's actually better.
Right.
Her number is 803-740-0979. I'm Cassandra Edwards, again, the founder of the Chosen Few Financial Empowerment and Wellness Workshops. This has been a QuickWits interview. This is where I'm just really enjoying doing short interviews with like-minded entrepreneurs to help you guys get some more exposure. And so it's effortless for me to expose you and introduce you to my business relationships community. So if you need to set one of those up with me, my email address is chosenfew.cedwards@gmail.com. Again, I'm Cassandra Edwards. Thanks so much again, Jenny. I'm looking forward to working with you more in the future.
Thank you.
All right. We'll talk to you later.
Bye.
Bye-bye.